18 feminine hygiene mistakes most women make. Having a clear idea on how your vagina works will help you better master your feminine hygiene. The vaginal flora constitutes a fragile ecosystem which is often damaged by hormonal variations, puberty, pregnancy, menopause, and other various factors such as stress or use of certain drugs, antidepressants, antihistamines, for instance. Its balance is based on a specific acidity and the presence of protective bacteria that must be kept intact at the risk of itching, burning, or yeast infection. Causing the good habits are therefore essential when it comes to a woman's personal hygiene. To avoid vaginal infections and others, here are some hacks and tips to help you adopt good daily feminine hygiene practices and avoid certain mistakes some women make. In this video, you will discover 18 feminine hygiene tips which you can use to help stay healthy and fresh. But before I proceed, please subscribe to the channel to help us establish our presence on YouTube. 1. Use a toilet mitt. While using exfoliating mitt in the shower or bath is common, it is not recommended for feminine cleaning. It is a real nest of bacteria. Regardless, you should especially not use a washcloth in your personal hygiene. The intimate cleansing gel should be applied and rinsed directly with your hand. 2. Self-medication. At the first signs of itching or discharge, some women self-medicate by purchasing antimycotic medications directly from a drugstore without a prescription. However, itching does not necessarily mean yeast infection, so the medication may be unnecessary. If you get irritation or itching associated with a persistent discharge, it could be vaginosis. Then you would need to consult a gynecologist before purchasing self-prescribed medications. 3. Sleep with a pad. Sleeping with a tampon can lead to toxic shock syndrome, a rare life-threatening complication of certain types of bacterial infections. As long as it is possible, do not sleep with a tampon as it may facilitate the entry of the TSST-1 toxin into your bloodstream through the lining of the uterus. It is better to opt for a sanitary napkin. 4. Not urinating after sexual intercourse. This is to avoid the risk of urinary tract infection. Urination gets rid of the germs. Peeing after sex helps flush bacteria out of the urethra, thus helping you to prevent a urinary tract infection, UTI. It is especially important for women with weak immune systems or those who are prone to UTIs. 5. Use vaginal pearls. By using vaginal detox pearls filled with water to clean the inside of the vagina, good bacteria naturally that is present in the vagina are reduced, and which increases your risk of infection. In addition, it will disturb the normal vaginal pH levels between 3.8 and 4.5. The fact that the water has a pH of 7 while the acid in the vagina is 4, if the vagina is less acidic, there is a risk of bacterial vaginosis, BV, and abnormal vaginal discharge, which is caused by an imbalance of good and harmful bacteria. 6. Wash too often. Frequent cleaning of your vagina will not make the typical odor go away. In fact, it may lead to the infection and worsen the problem. Every woman has a distinct odor down there, which is a result of a combination of the normal bacteria living in your vagina, diet, your level of hygiene, your bathroom habits, and gland secretion. To avoid damaging the hyperlipic film that protects the vaginal wall, do not wash your private parts more than twice a day. Too much repetitive washing is aggressive on the mucous membranes. It can create fragility and thus increase the risk of irritation and infection. 7. Daily use of intimate wipes. Like pantyliners, intimate wipes can be irritating if used daily because the chemical they contain. After using a wipe, it is important to dry off afterwards. In addition, it is best to use a thermal water mist sprayer to cool off. 8. Full depolation and razor. Pubic hairs plays a protective function by catching pathogens that could otherwise enter your body. While it is common feminine hygiene practice, removing pubic hairs may be therefore putting you at higher risk of infections such as UTIs, vaginitis, and yeast infections. With full hair removal, the vulva is more exposed, increasing the risk of irritation. The razor, on the other hand, can generate microcuts that can lead to formation of germs. 9. Use any feminine hygiene product. There are plenty of feminine hygiene products on the internet, but it does not mean all of them are safe. To avoid any problems, it is better to use personal care gels and intimate wipes sold in pharmacies and drugstores, dermatologically tested, or from a brand you give some credit to, such as Lulun.com. Remember, big brand does not mean safer either. 10. Douching. Some women douching just to feel cleaner. It is absolutely necessary to banish this habit because it damages the vaginal flora by flushing lactobacilli, non-harmful germs present in the vagina, to protect it. This habit disrupts the natural pH because the water has a neutral pH of 7 while the vagina has an acidic pH of 4.5 max. If the vagina is less acidic, it may develop vaginosis, which causes irritation and a smelly vaginal discharge. The opposite effect to what you want. 11. Use a washcloth. This is a somewhat old-fashioned habit of feminine hygiene with the washcloth is not healthy, although some women still do it. Gynecologists say using a washcloth to clean private parts increases the risk of infection because they are breeding grounds for germs. Use the same soap for the body and the vulva. Choose a soap for your feminine hygiene that suits your vaginal flora without cleaning the inside of the vagina, of course. In case of necessity, use a gynecological soap with basic pH. Otherwise, choose a soap with an acidic pH between 3.8 and 4.5. 13. Panty liners too often. Classic non-organic panty liners and sanitary napkins contain many chemicals, even toxins, that can cause irritation and allergies if worn too frequently. In fact, wearing sanitary napkins increases the risk of germs and bacteria macerating in genitals and can cause cystitis. If you must wear this type of hygienic protection, prefer organic ones. Change them several times a day by washing your hands before and after and wear it occasionally. It is also essential to change your underwear every day. 4. Wipe backwards. In fact, to prevent the intestinal bacteria present in the anal area from affecting the vulva and causing infections, you should wipe from the vaginal to the anal area. Doing it the opposite way can lead to serious yeast infections. 15. Use a shower gel in the vagina. It is important not to use a shower gel that you use for your body. Indeed, the pH of the latter is not adapted to that of the vagina. Instead, you must opt for a specific product with an appropriate acidic pH intimate cleansing gel. 16. Wear tight clothes. Wearing tight clothes that are too tight can also have an impact on the private parts. The friction of tight-fitting clothing can cause not only burning sensation, but also losal maceration, which can lead to an overgrowth of germs. This is especially important after sex because fluids persist in private parts. It is therefore preferable to opt for loose clothes. If the underwear is made of synthetic material, it is even more harmful. They are not absorbent and promote maceration. 17. Leaving menstrual products for too long. For good personal hygiene, it is necessary to regularly change your periodic protections. Sanitary napkins can be kept for up to 8 hours, and tampons and menstrual cups must be changed every 4 hours. Leaving a tampon in for too long can cause serious infections and, although rare, life-threatening toxic shock syndrome, TSS. Women with a weak menstrual flow must be particularly vigilant. In their case, hygienic protections absorb too much secretions, and this can disrupt the vaginal flora. 18. Keep a wet swimsuit. Local humidity promotes the growth of bacteria. After a workout or a day at the beach, you should get rid of your wet clothes as quickly as possible. Ditto when you get out of the shower. You should dry yourself well and change your towel regularly. Thank you for watching the video to the end. Remember to like it and subscribe to the channel to help us expand our presence on YouTube. We upload videos every week. Please press the bell icon to receive notifications.